I am your host, Dr. Jack Braha, and welcome to the MedCast Plus show. Here we feature local healthcare providers and physicians to give us some great tips to stay healthy here in Brooklyn and beyond. Today, our guest is Dr. Andrew Winer. I am honored to have him on our set today. He is an accomplished urologist specializing in diseases of the kidney, bladder, prostate, and more. He completed specialty training at Memorial Sloan Kettering Hospital in the treatment of urologic cancers. He is currently the Chief of Urology at Kings County Hospital Center. On today's show, we will focus on the men out there and how we can treat, prevent, detect prostate cancer. So I want all the women watching today to call your husband, boyfriend, dad, brothers, and everyone else to make sure they tune in and watch today's important show. Welcome to the show, Dr. Winer.
Thank you for having me. I'm excited to be here.
Oh, it's a pleasure. It's a pleasure. This is an important topic for all the men out there, and there are many men out here in Brooklyn. Prostate cancer is on our minds. Diseases of the prostate are on our minds. And we would love to know ways that we can prevent, treat, how to detect this early, because prostate cancer is so common. So tell us a little bit about the prostate, how it functions, and why it's so important to us men.
Sure, yeah. Prostate's an interesting organ. It's a small gland about the size of a walnut, and it sits just below the bladder and just in front of the rectum. And the urethra, the tube that the men pee through, it runs directly through the middle of the prostate. And it secretes a fluid that allows the sperm to survive so that when it enters in the female, the sperm can impregnate a woman and thus have children. Interestingly, though, after reproductive years, it only causes trouble. So there's really no benefit to the prostate after reproductive ages.
So this is sort of like other organs in the body that we hear of, like the appendix that can be removed and life goes on.
Correct.
The gallbladder can be removed and life goes on. The prostate itself, after men are done having children or procreating, essentially becomes something we don't need but can cause us trouble.
Correct. It can obstruct, it can turn into cancer, can cause all sorts of trouble.
And obstruction, we're talking about when a man wakes up multiple times at night. We see the commercials on TV. Do you have a growing problem? Do you have a going problem? Is this what we're seeing on TV?
Absolutely.
Right, so this is called BPH, correct? Explain to our viewers a little bit about the growing problem that's out there.
Sure, so BPH, or benign prostatic hyperplasia, is the growth of benign or non-cancer cells within the prostate. And it essentially, if you think of it about it like your kitchen sink, it's your kitchen sink that gets clogged. And so, the urine is still being made, but it can't get out completely. And so the prostate is serving as a source of obstruction. And it causes a collapse of the lumen, or the opening of the urethra. And so not all the urine can be released from the bladder.
So basically the pipe that's draining our urine from the bladder out to the toilet is being pressed on by the walnut-sized prostate, which might not be walnut-sized anymore. It might be growing a bit
What's
bigger.
interesting, though, is that prostate cancer develops in the backside of the prostate. So while a lot of people think that prostate cancer may cause these obstructive symptoms, it actually is very rare. Only in late stages will it cause those types of obstructive symptoms.
Right, so a man watching today who says, oh, I've got no problem going to the bathroom, I can pee, I go, no issue, that doesn't mean you're clear of prostate cancer.
Correct. And that's why one of the important take-home messages today is to know your numbers.
Right, so that's another campaign we see out there with prostate cancer is know your numbers, and the number that you're referring to is called the PSA. Tell our viewers what a PSA is.
The PSA is the prostate-specific antigen, and it's a molecule that is secreted by the prostate only. And again, it has to do with the liquefaction of the semen or the sperm. And again, after reproductive years, it only serves to just utilize as a biomarker or a test that we can use to check for prostate cancer. It's a simple blood test, and we use cutoffs to determine whether or not a man is at risk for prostate cancer.
So this PSA number, when should a man watching today go to their doctor and say, hey, what's my PSA? When should I check that? What age is the right age?
Well, it depends on which criteria you're using and the risk factors of the patient. So if the patient has 0 risk factors per the AUA, or American Urologic Association guidelines, typically it's a shared discussion with your urologist or your primary care doctor, but typically we say start around age 55. In a man with risk factors, and risk factors would include three things: age, so as they get older, more men will develop prostate cancer, but primarily race and family history. African Americans are 2 to 3 times more likely to be diagnosed with prostate cancer. And when they are diagnosed, it becomes a little bit more aggressive than Caucasians or Asians or others. And then the other risk factor is family history. So if you have a direct family member, a father, a brother, then you are at risk for developing prostate cancer. So these patients, in my practice, I typically recommend getting at least one PSA checked at the age of 45. And if it's less than 1, then they can wait another 5 years or so before getting checked again.
And this PSA test is drawn in the office.
Yeah.
It's a simple blood test. How long does it take to come back in general?
About a day. So you can find out the results in about a day. It's typically accompanied by the man's favorite thing, which is a digital rectal exam.
The DRE.
Oh yes, the famous DRE, where we insert a finger into the man's rectum and feel for the prostate. And as I mentioned earlier, prostate cancer develops on the back side of the prostate, and that's why you can feel prostate cancer nodules that develop.
Right. So I'm a gastroenterologist. So in my practice, when I do colonoscopies or exams, I do rectal exams, both for men and women. And for the men, we always take a nice sweep of the prostate, and often I'll feel an enlarged prostate or something that feels abnormal, and we send them over your way. And you're right, men fear that exam
More than anything.
And unfortunately, it is uncomfortable for the 20 or 30 seconds or less that it takes, but it's essential.
Yeah. I'll tell the men out there, I dislike it just as much as you do.
We don't enjoy doing the rectal exam. It's part of the business.
Yeah.
But it can really save a life.
Absolutely. It's a necessary evil.
Yeah. And that combined with the blood test in your office, within a day they get a result.
Yeah.
And combined with the rectal exam, you can give somebody peace of mind at least. Hey, listen, the numbers are okay right now.
Yeah.
Or if you find something, so say you have a patient who comes in, you feel something abnormal or the PSA comes back elevated, what are the next steps in detecting prostate cancer?
So you have to take into account all the different factors. If the PSA has shown a trend that's going up over time, then the next step is typically a prostate biopsy. And that's where we'll take a few pieces of tissue from the prostate and send them off to a pathologist to review. And if it comes back as benign, then everybody's happy and you can rest assured that, at least for now, there's no prostate cancer. And if it's prostate cancer, then we have to discuss various treatment options. Now, not all prostate cancer is the same. Prostate cancer tends to be a fairly slow-growing type of cancer. So of all of the cancers out there to get, it's one of the better ones to have.
If there was such a thing as a good or better type of cancer, right. This is slow.
But they're not all equal. So we have low, intermediate, and high-risk cancers, and they act very differently. So a low-risk prostate cancer, we may consider something called active surveillance, where we just simply monitor the patient with PSAs, occasional MRI, and potentially a repeat biopsy 1 to 2 years later. If it's intermediate risk, that means this may actually shorten a man's life. It may be the cause of his death earlier than anticipated. And so in those cases, we would recommend some intervention. And in that case, we would recommend the standard treatment options, which would be either surgery to remove the prostate or radiation options. And there are some alternative options that we can discuss later, but the standard options are surgery and radiation. And for the very high-risk ones, those are the ones that will act very, very quickly. Those you have to make sure they haven't metastasized or spread to other parts of the body. And we may need to include other treatment options such as hormone treatments and whole body radiation, etc., for those men.
So there's really a spectrum of pancreatic cancers that are really slow growing, where people might just live with them and watch and see how it goes, medium and sort of the high risk.
Yeah.
So at Kings County Hospital, where you're at, here in the heart of Brooklyn,
right,
one of our oldest, most famous hospitals here in Brooklyn, what are the options that you're using here? I hear something called a robotic prostatectomy. Does a robot do the surgery, or do you actually do the surgery? Tell our viewers a bit more about what are the options at Kings County.
Yeah, so at Kings County, we're proud to offer the latest in the treatment for both surgical and radiotherapy options. As a surgeon, I've been trained and utilized the Da Vinci robot, which we recently acquired. And one of the things that I really like most about it is the way that the patients feel afterwards. The patients recover much quicker from this type of surgery. The incisions are smaller, it's more precise, they stay in the hospital one night, and typically less blood loss and less pain. Furthermore, as a surgeon, we can see right next to the organ that we're going to be operating on, and so the actual operation is much more precise. With regards to radiation, at Kings County we offer IMRT, or intensity modulated radiotherapy, and it's also a very precise way to deliver radiation. And so we're very proud to offer the whole spectrum of treatment options at Kings County to our patients.
So patients are presented with the options of treatment, whether it's surgical, radiation therapy. Obviously, the medical therapy like hormones is more for patients where it might have metastasized.
Right.
What makes a patient choose surgery over radiation or radiation over surgery, or is there any reason to choose one over the other?
Yeah, well, so, a number of studies have shown that typically men who are younger tend to do a little bit better with surgery for a number of reasons. One, younger patients heal better. Two, radiation has a cumulative side effect profile. So over time, side effects from radiation can accumulate over a man's lifetime. So the average onset of radiation side effects is around 2 to 5 years, and it can build up even over the course of about 10 years. So this compares to surgery where you cut somebody and they heal for the ensuing several months, and typically by roughly 6 months they're back to close to their baseline, or as close to the baseline as possible. Both treatment options affect a man's ability to control their urine and their erections for sexual activity. Now, as far as which to decide upon, that's a discussion that you'll have with your urologist and potentially a radiation oncologist. But in general, for younger, healthier patients, I tend to offer the surgical option because they return to their baseline function much quicker and don't have to deal with the long-term side effects of cumulative radiation side effects.
Right. Everything in medicine obviously has its upsides, and there are also the downsides, or what we call side effects or complications that can go on. So it sounds like it's important for the man and his family to meet with radiation oncologists, to meet with a urologist, sometimes even an oncologist in the situation, and come up with a customized plan. And at Kings County, you're able to offer what sounds to be a whole milieu of treatment options.
Yeah, we can offer pretty much the whole comprehensive package, which is very nice because rather than having to go to different facilities for specialized care, we can offer it all in one center.
And this is important because having been in Brooklyn now myself for 15 years, taking care of people and in the practice of medicine here for quite some time, it's important when patients are able to get their care in one spot for a specific disease. And so comprehensive prostate care is available at Kings County Hospital Center with the great Dr. Winer, who we're really happy to have here today, even though he is a Brooklyn transplant, correct?
Correct, yes.
So tell me, in Brooklyn here, obviously we have a very mixed population, and you told us about African Americans, Afro-Caribbeans having a higher risk of prostate cancer. For the men and maybe the women watching today who...
Please, women, listen.
The women in the household who help provide a lot of the care, please look out for your men. What should both men and women today know about some of the scary warning signs of prostate cancer, that if someone in the household is talking about a symptom or so, what should they look out for that says, hey, listen, I got to get someone to the urologist right away?
Yeah, thank you for having me today, because this is really one of the most important aspects. Unfortunately, prostate cancer is something that is what we call a silent killer. So you may not know that you have prostate cancer until it's too late. And that's why we have very clear screening mechanisms for this. And the invention of the PSA in the late 80s really revolutionized our care for this disease. And I was recently made aware that your own father, was a prostate cancer survivor, likely due to the fact that he had his PSA checked. And so PSA is really the important thing. So while you may not you or your husbands or significant others or family members may not know that something is brewing within them. The most important thing is to have a close relationship with your primary care provider or your urologist and get screened early, and then make an informed decision from there.
And this is the important point for the viewers today who are waiting to hear that magical, oh, if this occurs, you must go to the urologist.
Yeah.
Just like colon cancer and how we do colonoscopies, no matter what the symptoms, most of the patients have no symptoms with prostate cancer. And most of the patients with colon cancer that we find, or polyps that we find, don't have symptoms. So for the viewers today, for mom or the wife at home or the man watching today, if age 55 comes across with or without symptoms, the man should be screened for prostate cancer. Or if there's risk factors, African Americans, Afro-Caribbeans, patients with a family history, age 45, come and see Dr. Winer, or more importantly, really just see the primary care doctor. Right? Most of our patients in GI and gastroenterology, and I'm sure in urology, are referred over by a primary care physician.
Yep.
And so that's important. So for the viewers today, Dr. Winer is telling us you don't have to wait for a symptom, and you shouldn't wait for a symptom.
Correct.
Because then it might be too late. Right. Let's talk about some of the other urologic conditions that men out there might be interested in.
Sure.
We'll briefly touch, with some of the time we have left here, about erectile dysfunction. Could that be a sign of cancer?
So the mechanism for the men's erection is totally separate from the prostate. So typically erectile dysfunction is not associated with prostate cancer or any of the other urologic malignancies. Erectile dysfunction is more a side effect or an associated symptom of cardiovascular or
blood vessel disease.
Yeah, blood vessel disease, exactly. High blood pressure, diabetes are the two most common causes of erectile dysfunction.
And so it can attack any age.
It can,
right?
As early, in men in their 30s, we sometimes see with some,
especially
evidence.
A diabetic 30-year-old, a hypertensive 30-year-old.
Well, nowadays with the obesity epidemic, more and more early onset diabetes, we're seeing patients younger and younger.
Right, so not necessarily a sign of prostate cancer, not usually, but a common condition, and more common now because of all of the diabetics that we see and the high blood pressure patients. Erectile dysfunction, not something to be ashamed of. They should come see you. There's options for treatment.
Absolutely. Yeah, the options run the spectrum. I mean, sometimes erectile issues can be psychogenic, meaning just, anxiety, or not necessarily a medical reason. And so sometimes it just needs a little bit of encouragement. And then it runs the whole spectrum of medications, and even some surgeries can help. So, yeah.
So erectile dysfunction, we talked a little bit about that. There's treatment options out there.
Absolutely.
Unless you see a doctor, you're not going to get the full treatment available to you. So it's important to see the primary care urologist if needed for erectile dysfunction. We touched a little bit, and I know the men out there are watching because, when you're on the airplane and that fasten seatbelt sign comes on and all of a sudden you got to go, or you're waking up in the middle of the night and you see the bathroom quite a few times because of the growing problem we touched on. Let's talk about that because we said that that's probably not a warning sign of prostate cancer, but it is a sign of BPH, benign prostatic hypertrophy. When you evaluate a patient who says, hey, I'm going a lot, I've got some trouble peeing, I can't get the urine all out, I make 10 trips to the bathroom, my wife wants to throw me out of the house, we can't, every time we try to leave the house, I'm going back to the bathroom, and it's frustrating. Tell us what are the treatment options out there for this.
It's funny that you mentioned that. So one of my favorite things is that men with BPH or symptoms of BPH typically know where every bathroom in their local vicinity is because they've mapped it out.
So true.
They even on a family trip, they know where all the locations of the bathroom are. So first of all, BPH it's a diagnosis, but it's more of a symptomatology, right? So it's the going to the bathroom too often, having to rush to the bathroom, not feeling like you're completely emptying, feeling that your urine stream is very slow, waking up too many times at night. So a lot of people will come in and say, yeah, doc, I don't have any trouble going. I pee regularly. But the problem is that over time, these symptoms happen over many, many years. And so they don't realize that this is actually abnormal. And so first thing you want to make sure is that your PSA is okay and that this is not a sign of late-stage prostate cancer, which can grow and block off the urethra and then cause these obstructive symptoms. Once that has been set aside, once it's definitely not cancer, then we have a number of options. This is one of the most common urologic conditions that we deal with. I would say probably half of the men that we see in our practice have some sort of urinary issue, right?
Someone might have already gotten up while watching this show
Correct.
to go to the bathroom because
so
of
welcome
this.
back.
Welcome back to the show.
Right. So the beauty is that in our current armamentarium, we have a tremendous number of great medications to treat this. Running from the Flomaxes of the world, which you may have seen on the TV, to the finasterides, which help shrink the prostate. So we can both relax the prostate and shrink the prostate with medications. And if medications don't work, we have very simple procedures that can quote-unquote open up the prostate.
My patient told me the other day he went for the Roto-Rooter.
Perfect. Exactly.
What is that exactly? Explain that a little bit.
So what he's referring to, or the patient's partner, significant other, is referring to is it's called the transurethral resection of prostate, or a TURP.
TURP, right.
Yeah, colloquially known as a TURP. And basically you enter into the men's urethra and you essentially shave out the inside of the prostate, or core out the apple, and open up the channel to allow the urine to flow freely.
Important,
Yes,
because you're right. Men will start to live with this and not realize that they have a problem, but the family realizes. They're like, oh, Dad's going to the bathroom again for the 5th time this hour. Or you see a man climbing a fence to find the bathroom somewhere because it can be really painful, or the urgency can be there.
It's amazing. Some of the patients that we treat for cancer are very happy and thankful, but the patients who feel the most benefit are the ones
with the benign,
with the voiding dysfunction relief.
So another topic that we should touch on also for the men watching, and women too, because this can affect both, is kidney stones. The rocks, the diamonds, the stones, these painful, and when we show them to patients, they can't believe such a little stone caused so much pain. But let's talk about nephrolithiasis, kidney stones. And what can someone out there who has been diagnosed with kidney stones in the past do to prevent getting kidney stones again?
Well, as a stone former myself,
Uh-oh.
and I was treated at my own institution, which was
Did you treat yourself, or you had a friend?
We had another consultant come in.
Okay, great.
It is a very painful thing to go through. I won't equate it to delivering a child, which a lot of people do out of respect for my wife, but it is extremely painful, and it's something to be aware of. Family history is actually one of the most commonly associated risk factors. There are a number of risk factors.
So here we go blaming mom and dad again.
Yes, exactly.
Okay.
But family history is extremely important for stone formation. The most important thing to prevent stones is to stay well hydrated, particularly in the summer months. And one thing that people aren't aware of, but is actually very helpful to prevent stones, is to put a little bit of a citric acid fruit, like a lemon or an orange or a grapefruit, into the water that you're drinking. And that can actually help prevent the formation of stones.
So a little wedge of lemon or lime might
exactly.
go a long way. Get some extra vitamin C.
Yeah, we say drink over roughly 2 liters of water a day, which seems like a lot, but it's very important, especially if you have risk factors. For
hydration is key. I think also for what we deal with constipation. When I talk to my patients, and you take a good history, we don't drink enough. And it's got to be water. It can't be soda and caffeinated beverages, because they actually dehydrate us a bit.
Exactly.
So a little bit of lemon or lime, a little bit of citrus in our water can help prevent stones. The treatment for stones these days, what are you doing for patients who have stones that won't pass on their own?
Right. So a stone less than 5 millimeters or so will typically pass on its own. So we can just observe them, wait for it to pass. Larger stones, we have to use some more sophisticated techniques. We can use shockwave lithotripsy, which is outside of the body for a smaller stone. We can use a small camera and a laser to fractionate a stone and break it up and get rid of it that way. And for bigger stones, sometimes we have to actually go through the back and use almost like a little drill and break up these big stones. But all of which are minimally invasive, and patients recover exceptionally well. Unfortunately, once you've developed the stone, you're at risk for developing more. So roughly 50% of patients who have developed a stone will have another one at some point in their future.
Right, so the basics of kidney stones, very painful.
Yeah.
Can be prevented with adequate hydration.
Yeah.
Might be blamed on mom and dad because we can't change our genes, our DNA. That might put us at risk. But there are treatments out there for this that are minimally invasive. Small stones less than 5 or 6 millimeters?
Yeah, roughly.
Right, so if a patient has a very small stone, they often leave the emergency room with a little basket to catch it in.
Right.
They're told to strain their urine.
And some medication, exactly.
Right, and it should pass on its own. Very interesting. So kidney stones themselves, do they affect men or women more?
So it used to be men were more affected, but in recent years we've seen a shift towards women, actually. Women have recently surpassed men in terms of prevalence for kidney stones.
But affect both men
both.
and women.
And we see a rash of them develop in summer months, as you would expect, because people tend to drink less and become a little more dehydrated.
In the last few minutes we have, we always like to get to know our doctors a little bit more personal. We want to know more about you. So I think I mentioned earlier in the show, we're going to go over now to our Kings County questions here.
Okay.
So this is a local Brooklyn show. We're going to ask about some local Brooklyn questions. I think you mentioned that you're a transplant, or are you Brooklyn native?
I'm originally from Northern California and transplanted to Brooklyn.
Welcome to Brooklyn, welcome. Likewise am I. I'm a transplant as well. So, favorite restaurant in Brooklyn? I know you've been here long enough to figure this one out.
Yeah, we're going with Della Rocco's Pizza.
Ah, pizza. Everyone in Brooklyn likes pizza.
Yeah.
Mets or Yankees?
Oakland A's.
Oakland A's. I knew it. Oakland A's. Knicks or Nets? Where
Golden State Warriors.
Golden State Warriors.
And I'm not a bandwagon.
Brooklyn patience. I don't know if you're going to go to this doctor. Let's see.
Yeah.
Well, thank you for being here. This is an important topic. All the men out there, and I am sure all the ladies who are concerned about their men, have benefited from all the information. Get screened for prostate cancer. It is a preventable disease. Detected early, it can prevent metastatic spread around the body. Get your PSA checked, a rectal exam, starting at 55, or if you have risk factors at 45. Thank you for your interest in the show. I invite you to visit our website at medcastplus.com and check out our tools and connect with us on social media. You can also call us at 718-510-2103. Thank you. Stay healthy, Brooklyn. See you next time.